Sanibonani, goeiemorgen. Welcome to Good Morning Africa, your biggest and brightest breakfast show. Ongoing health, I'll be chatting to our resident Dr. Mohamed about IVF, that's in vitro fertilization. Thank you again for joining us, Dr. Mohamed.
Thanks for having me.
It's a pleasure. It's always a pleasure having you here.
Thanks, Darren.
Please, can you tell our viewers exactly what IVF is?
IVF basically stands for in vitro fertilization. And in vitro means outside the body. In vivo means inside the body. Now, IVF originally was, when we started off with IVF, it was a treatment of choice for what was known as infertility due to blocked tubes. So what happens is that when the fallopian tubes are blocked, it can't pick up the egg and the sperm can't get there, so they can't reach there. So it came about that you remove the eggs from the ovary, mix them with the husband's sperm or a donor's sperm, grow the eggs outside, in a test tube in a laboratory for about 3 to 5 days. And once they are grown into day 3 or day 5 embryos, we put them back into the uterus, into the lining of the uterus. So originally it was a treatment of choice for blocked tubes, infertility due to blocked tubes. But it has over a period evolved as a very effective treatment for all types of infertility. And recently with IVF and ICSI, it's now become a treatment of choice for male infertility.
Okay. And what tests need to be done before you can start IVF?
Well, ideally, one needs to find the cause of IVF for infertility. IVF doesn't cure infertility because the infertility that existed there before, say if infertility was for blocked tubes, the tubes will remain blocked whether the woman falls pregnant with IVF or not. So it doesn't cure infertility, it's just a treatment to bypass the cause of infertility. So ideally one needs to find the cause of infertility and treat that accordingly. But if we're just preparing the patient for IVF, then what we need is a sperm analysis. We need to determine the female partner's ovarian reserve, whether the ovaries are functional or not. So we need to do some hormonal tests. We need to see whether she's ovulating or not. We also like to see if there's no endometriosis or if there is endometriosis, if there's any fibroids. So we do a laparoscope and a hysteroscope. We can do an HSG. So some of these are the preparations prior to IVF that we do. We also need to make sure there's no tuberculosis or any sexually transmitted diseases present. So we do blood tests for that.
What is a follicle?
The follicle is basically what, a structure filled with fluid, and the covering of the follicle contains the egg that contains the egg. And when that follicle matures, when it gets to about 18 to 20, then on about day 12 to 14, it ruptures and the female ovulates and the egg is released into the system. So a follicle means a fluid-filled structure containing the egg, and it's found in the ovary.
And what are the kind of some of the medicines used for IVF?
Now, in a menstrual cycle, if you take a normal menstrual cycle, this cycle is governed by hormones that are secreted by the hypothalamus, by the pituitary and the ovary. So there are certain hormones that are secreted, which is FSH, LH, estrogen and progesterone. These are the same hormones that we use during an IVF cycle. And we use Lucrin basically to flatten or to control the cycle. When we put a person on Lucrin, the menstrual cycle is abolished. We then artificially take over the menstrual cycle and we stimulate growth of the eggs with FSH and LH, hormones that were secreted or normally secreted by the woman, by the pituitary of the woman. And these hormones then normally under normal circumstances stimulate the ovary to produce and grow the eggs.
And what are some of the complications of IVF?
IVF fortunately doesn't have many complications. One of the main complications we have is multiple pregnancies like twins and triplets and quadruplets. Those are actually complications of IVF. But those are avoidable if you reduce the number of eggs that one transfers. But the most serious complication of IVF is known as ovarian hyperstimulation syndrome. That's quite a serious. It's usually, under normal circumstances, it's a self-limiting complication. But sometimes, about 1% of cases, one can get severe ovarian hyperstimulation, and sometimes it can be life-threatening. Sure. But most of the time, one can pick this up early in the cycle, and if you do pick it up, then you can either cancel the cycle, so then it's completely safe. It'll just fade away. One can withdraw. There's an injection that we give to trigger ovulation, so one doesn't give that injection, and if you don't give that injection, again, ovarian hyperstimulation will be self-limiting. But if it does develop, then it produces a lot of fluid in the abdominal cavity. It produces a lot of fluid in the lungs, and one has difficulty in breathing. One can be prone to clotting, emboli forming. So it's a serious disease. But in most cases, one picks it up early and takes steps to prevent it. The best form of treatment for ovarian hyperstimulation is to prevent it. So what we normally do is we try and assess if a patient is at risk for developing this, and then we act accordingly. For example, patients who have polycystic ovaries, they are at risk for it. So in those cases, we normally start off with a lower dose and try and prevent it.
And when do you know that the eggs are ripe?
Well, during the cycle, we monitor the patient, every 2 to 3 days, and we measure the follicles. And once the follicle we get 2 follicles that are 18 and about 3 that are 17, then we trigger, because then the follicles are ripe, and then we remove the eggs from the follicle.
And what happens at egg collection?
Egg collection is when we trigger it and it's ripe, and then we actually remove the eggs from the follicle. What happens is that we advise the patient not to eat or drink anything overnight, and then she comes in and we give them a mild anesthetic, and then we insert an ultrasound into the vagina with a needle, which is attached to a pump, an aspiration pump, and we puncture those follicles and we aspirate the eggs from those follicles. It's not a very difficult procedure.
And embryo transfer?
Embryo transfer again, but that's not done under sedation. It's once the embryos are grown to day 3 or day 5, we take the embryos and load it into a soft catheter. And then with the woman, it's like a pap smear. We got the woman in what we call lithotomy position. And then like a pap smear, we insert a speculum into the vagina, and the catheter is then introduced through the cervix into the uterus, and then we just drop the embryos there.
Okay. So if a couple is not from South Africa, they're from another country and they want IVF, what preparations can they do before they have IVF?
Well, ideally it's good to work with someone who's in that country, like a doctor. But there's a list of blood tests that need to be done, okay? Those blood tests can then be done by their doctor in their country, and the results sent to us. We also have certain x-rays, HSG can be done there. And then once they're deciding to come for IVF, then what we normally do is we put them on a contraceptive pill a month before they arrive in South Africa. And then they stop the pill a day or 2 before they coming to South Africa. In that case, they would bleed when they land here, or a day or 2 later.
Yes.
We then start them on the stimulation cycle to collect the egg. So all in all, they stay here for about 14 days.
Thank you so much for joining us again, Dr. Mohamed. And if our viewers need to get hold of you, please can you give them your details once again?
Or they could email us at info@santonfertility.com.
Thank you, Doctor. It was lovely having you again. It's always a pleasure having you here. Always learn so much. So thank you for that.
Thank you for having me.
Our viewers at home, if you have any questions or any queries or comments for us, you can email us at gma@planetimage.co.za. Thank you so much for joining me here in Going Health. I look forward to seeing you again, and back to you in studio.